Hi everybody, Ziv Simon here. I'm the creator of Surgical Master. Welcome to this video. And this is a really quick one sent to me by Dr. Amir Doha from Egypt, who sent me a photo of a patient with a perio problem, and he had a question about this case. Now, the quality of the photo may not be 100%, but it's so extremely valuable to look at all the details that you can take from it and draw some initial conclusions and maybe search for more information. It's just one piece in the puzzle. So don't fall into the trap of dismissing any type of information because it's partial. Yes, I'm all for comprehensive evaluation and getting all the data in front of me before I make any clinical decision and recommendation, but anything helps. And you'll see that with this photo, whatever quality it is, you can draw some serious conclusions. And I hope this is going to be helpful to Dr. Doha in Egypt. So here it goes. So the information about this case is that this patient is 22 years old and healthy, no medical concerns or medications. And I guess it's a woman because Amir said that the patient is not pregnant, so I would assume. And the patient is not a mouth breather, so that shows me that Dr. Doha has already considered the role of mouth breathing in gingival inflammation, especially for the anterior segment. So he looked into that, and that the patient is in ortho treatment, or maybe before ortho treatment, because I don't see any at the moment in the photograph. And another piece of information is that this patient did not respond to any type of periodontal therapy, and I don't have more information about what type of therapy. So there's a lot of data here in front of me, and what I typically do when I work up a case, and especially when I have limited amount of information, what I start to do is very simple. I start to describe what I'm looking at. Okay, so I'm going to zoom in a little bit and let's look at the detail. So we're looking at a 22-year-old patient with severe gingival inflammation, especially in the interproximal area. It looks like it's more in the anterior zone, but definitely going more posterior as well. Very severe inflammation. It looks like there's subgingival and supragingival calculus. We see this very clearly. I want to say there's a malocclusion in here, although it's hard to tell. And some type of linear erythema along the gingival margin, mostly on the upper right-hand side. You can also look at some mucogingival problems with thin tissue, minimally attached and keratinized gingiva, a frenum pole associated with it, and also gingival recession. So you see, once you start describing what you're seeing, the picture becomes much clearer. And to think that this patient is only 22 years old and having so much devastating inflammation, it's either a case of just neglect, meaning no routine oral hygiene and no dental care. That is an option, but this could be also in combination with some type of systemic condition and maybe some type of mucocutaneous problem like an autoimmunity. And I would like you to rule this out and not to jump to any conclusions. Naturally, we need to look at radiographs. We need to do a more thorough medical evaluation because many of these conditions can coexist and influence one another. And we need to make sure that we address this very severe problem. So this patient is definitely not ready for orthodontic treatment, no doubt about it. And we can have a preliminary assessment based on partial information. That's totally fine. What you need to emphasize is that this is just preliminary and your recommendations are tentative, some of which are what not to do, like not to proceed with ortho treatment at the moment, which is pretty obvious from the picture, because orthodontic treatment is contraindicated in the presence of active periodontal disease. And you can also make a recommendation to retrieve more data, like a full set of radiographs and also a medical evaluation. Anytime I see patients with a severe periodontal condition, I always refer them to a physician and like to do a general workup and blood tests, and just to make sure that they're generally healthy. What's optional is to do some bacteria testing, and it's a little bit controversial whether the results of this test are going to influence our treatment. I like to do that. For me, it's another piece of the puzzle, and obviously there are different ways to test for bacteria in the mouth, like actual sampling, and now we do more of the DNA testing and checking the different perio pathogens in the patient's mouth. I think that's important. And we start with the basics. We start with oral hygiene instructions and initiate some basic periodontal therapy with scaling and root planing, and maybe start with a full mouth initial debridement, what we call a gross scale, and basically reevaluate after 4 to 6 weeks. By that time, you'll get the medical evaluation result, you'll see the radiographs, and you'll be able to make some more definitive decisions and recommendations. So I know I didn't show you any fancy surgery or any complicated treatment sequence or plan, but really start with the basics. You'll do just fine. Don't get overwhelmed by how everything looks and the dramatic appearance of a patient, and just stick to basics and basic diagnostic criteria. And if you don't have enough information, make a recommendation to receive more, like what I showed you in this short video. And remember that even the most complex treatment consists of many, many little steps that are actually simple in themselves. So I hope this helps you. And thanks again, Amir, for sending this case to me and allowing me to share it with the Surgical Master community. I'm very sure that many doctors can learn from that. Thank you also for being such a great support to my videos. You sent me a screenshot from your computer where you organized all the Surgical Master videos at that time in one folder. So thanks for that, and for sharing and spreading the news with your colleagues. You actually printed the Money Tooth book. I'm so impressed. I don't have a printed copy myself, so that's so cool. So thanks again. I hope this video was helpful to you and your colleagues over there in Egypt. And if you found this video helpful, feel free to share it with other dentists. Feel free to leave me some comments below. Let me know if you have any questions. I look forward to getting some more updates on Amir's case in the future, which I'll obviously share with the community. And there's a lot more to come from Surgical Master before the end of the year, and a lot of big plans for 2016. And I'm so excited to share everything with you, so stay tuned.